So, wound irrigation. So, first thing I'm going to do when I enter upon the room, I'm going to introduce myself to Mr. Jones. Hello, Mr. Jones. I'm going to be your nurse today. My name is Kelsey. I'm going to do the wound dressing change. So, I'm going to provide patient privacy. I've gathered all of my supplies, verified that this is my correct patient. Have my waste disposal container right next to me, so I have a nice table work area that's been cleaned. I have all of my supplies. Make sure that this order has been initiated for this patient. So one of the first things I'm going to do is I'm going to ask Mr. Jones, do you need a pain medication before we get started in case he's going to be in any pain? If he says yes, I'll make sure that the medication is taken effect before I start the wound change. So once that's done, I'm going to remove the old bandage. So I'm going to get my gloves. After I perform hand hygiene. Okay. If I need an adhesive, I'm going to apply that as well, but I'm going to carefully use the push-pull method, slowly begin pulling the bandage away. And during this time, I'm going to assess the bandages for the color consistency. Carefully remove that. I'm going to toss that in the trash. I'm also going to check the inside of the bandages, check the inside of the wound. I'm going to throw those away. Check around the shape, the size, any if there's drainage. I'm going to check the outside of the skin. While doing that, I'm also going to do my measuring. So I have my Q-tip to carefully remove that. Check for tunneling. I'd also use this to kind of help with the measuring of the wound. Checking all sides. Also depth. Once that's done, I'll toss that away. If it is needed for a wound culture, I will obtain the wound culture now before I begin my irrigation. Since there's no wound culture needed, so I'm going to remove my gloves and start preparing for the cleaning of the wound. Carefully dispose of those, practicing hygiene. Now I'm going to set up my sterile field. So the first thing I'm going to do is I'm going to grab my sterile towel. Carefully grab it. I'm going to dispose of that, keeping this above my waist. Only touching the outside so I don't contaminate the sterile field. So carefully lay this on the table. Again, just touching the outsides, keeping the sterile field. Once that's done, I can now apply the sterile equipment. So I'm going to I'm going to put a cheg underneath my patient, as well as put this irrigation tray next to it. I'm only touching the outside, I'm not touching the inside. Put that underneath my patient. Down the side. Next, I'm going to grab my 4x4s. Drop. I'm going to put this next to me if I would need to do irrigation of the wound or extra irrigation. Tunnel dressing, drop. Trash. Fix. Drop. And I also like to get my teeth out. It's just quicker. Not touching my sterile field when putting the tape on the table. Next, I'll put the tape in case I need it. Now I can start setting up my sterile gloves. So open up my sterile gloves. Now I'm going to open a container of liquid to put into this container. Careful to keep the label covered. If this has been open, I carefully pour some into the trash. But since this is an unopened one, carefully I would peel it and then carefully pour it in, keeping it high but not too high and not too low. Just carefully put the cap back on because I'll be needing that soon. So now I need to touch the sterile field, so carefully open up my sterile gloves, covering my dominant hand first. Careful, don't only touch the inside of the gloves with the cuff. Now this, I can use this hand to arrange everything in the sterile field. So lay it all up. This up. If I needed to put gauze in the liquid, then I would carefully do that now. Since I need more liquid for the irrigation, I'm going to use this hand, which is not sterile. Carefully remove the cap. And again, I would just assess if the label, or cover the label. Also, if I need to pour out some liquid, I would do that now. But again, since this isn't open, carefully pour it in. As much liquid as I need. This hand is remaining sterile because I have not touched anything. Make sure the cap is covered. Now I can put on my non-dominant hand glove. Carefully go underneath the cuff. So now I'm sterile, so I can touch everything in a sterile field and I can begin wound treatment. So I'm going to take saline. And I'm going to carefully begin irrigating the wound. I'm going to go for more of the, if I were going to the side, I'd be going to top to bottom. Okay. Put that in the field. Now if I would need to carefully pat dry, I would carefully wrap a small pack of 4x4s, carefully not to touch the outside of the wound, but gently pat the inside. Drop that. Now I'm again packing the wound, so if I were to use the irrigated 4x4s, I would put that in there. I'm going to dry. Carefully begin packing the wound. Since this hand has been sterile and I have not touched anything, I'll use it to help pack while holding this as well. Not touching the outside of the wound, packing. Drop that. I'm also going to use 4x4 to carefully cover. Again, not touching the outside of the wound. I'm going to grab the abdominal dressing. And now this is clean, so I can use my sterile, or not, these are no longer sterile, my gloves are not clean, so I'm going to now apply the tape.
It's like hard because you can just stand there. Well, it's so it doesn't matter. Oh, it was in Alright, just walked into the patient center and I posted curtains for privacy. I'm gonna walk up and hi, my name is Peyton.
Once that's done, I'll carefully remove my gloves. Careful to not cause them to be thrown around. Dispose of those. Have the same hygiene. Now I'm going to date and initial the time when the bandage was changed. 2, and then what time it was taken. 2. Okay, after that's done, I'll be cleaning up my area. I'll check with the patient. I will make sure all the rails are up. Patient is at a lower height. Put the call lights next to the patient. Ask if there's anything else that needs to be done. Once that's done, after everything's cleaned up, perform hand hygiene and document everything's done.